For as far back as man can trace his history, there's evidence that arthritis has afflicted him. Findings suggest that the bones of early caveman were pitted with the deterioration we recognize as arthritis. And ever since, in every age and in every language, people have complained about the suffering caused by these disabling conditions. Over the years, medical science has sought ways to prevent and treat arthritic diseases, and certain centres have emerged in the research and care of people with the disease. One such place is in Bath, a city in the southwest of England. It has long been a centre for the treatment of those suffering from rheumatic conditions. Since the days of the Roman Empire, people have sought the medicinal relief offered by the natural hot springs, found not only in Bath, but in sites around the world. And in part, due to the presumed therapeutic value provided by these baths, the Royal Mineral Water Hospital, referred to locally as the Min, opened in Bath in 1742. Its purpose, the relief of the poor who suffered from such conditions. Today, renamed the Royal National Hospital for Rheumatic Diseases, it remains an important centre for the research and treatment of all musculoskeletal disorders.
For years, mankind has explored the nature of disease and its treatment. Arthritis is no exception. In what we now view as the dark days of medical science, when so many aspects of disease were misunderstood, isolating the sick was often considered to be in the best interests of the general population. In fact, the badges you see worn by these patients in this 18th century painting were meant to keep these suspected sufferers of arthritis from being served in public drinking places. We've certainly come a long way from those days, but despite major medical advances, arthritis still can restrict the activities of daily living, separating patients from the mainstream, from the movements and quality of life they may previously have enjoyed. There is much that we physicians can do to help, and there are medications we can prescribe for relief of pain and inflammation. But we also know that you, the patient, must take an active role in the management of your arthritis. One of the best ways you can do this is through the exercises that will be described in this program. By beginning an exercise program and using it to help counteract the effects of your disease, you can maintain muscle strength and improve the way you feel. You may even find that you function much better than you thought. And you'll be doing what you can do to free yourself from the restrictions that your disease imposes, to get back to the lifestyle that you enjoy.
Exercises are among the most useful and direct ways to minimize the limitations imposed by your arthritis. Arthritis is a disease that affects your joints and the structures that support and strengthen them. In a normal joint, the bones are cushioned by a layer of cartilage and fluid and are held together by bands of muscle and ligaments. For the joint to function effectively, the bones, cartilage, ligaments and muscles must work together. Osteoarthritis, the most common form, is a degenerative condition in which the cartilage of the joints becomes pitted and frayed. With time, the joint space narrows unevenly, causing the bones to be exposed and thickened. When these events occur, the joint becomes unstable and movement can become painful. In rheumatoid arthritis, inflammation plays a more important role, directly causing pain and swelling of the affected joints. In either case, as the joint becomes painful to move, there's a tendency not to move it. Because of the inactivity, the muscles weaken and shorten or contract. Exercise, then, is a way of stretching and strengthening these muscles, providing greater support to the joint and maintaining mobility. The exercises on which we'll focus can help you maintain a full range of movement. They can allow you to use your joints normally. These range of movement exercises are aimed at specific joints, as opposed to ordinary exercise such as walking, swimming or cycling that help you to increase your overall fitness. Both types of exercises should be included in your exercise plan. You will have greater stamina, feel better about yourself, have a better self-image. To derive all these benefits, however, you'll need to exercise regularly, even when you're feeling well, even when you don't think you need it. Find the time in your daily schedule to include exercise. Obviously, as with any exercise program, it's important before you begin to consult with your doctor or physiotherapist. Discuss what you should and should not attempt. This is particularly true if you've had joint replacement or if you suffer from osteoporosis. If, while exercising, you feel chest pain, become severely short of breath, feel dizzy or nauseated, stop exercising immediately. Most importantly, understand that with the right plan and the proper precautions, exercise can be an invaluable part of managing your arthritis. Before you begin to exercise, you may want to warm up with a warm bath or shower. 2 or 3 exercise periods a day of 5 to 10 minutes each are a good goal to set for yourself. On days when you have a lot of pain, cut down on the number of times you exercise or the number of repetitions, or eliminate particularly painful exercises. You must listen to your body. It is the best barometer of how far you should go.
Let us begin to look at some neck and shoulder exercises. Here we're looking at this lady who has neck pain, and she's improving her posture and the musculature that support the head. She's pushing down, sucking in the head towards the ground and the chin, and getting rid of the curve, the natural curve of the neck. She's counted 5 slowly and relaxes. And we would ask her to do this some 10 times. Again, 3 times a day. It's helpful if you think of a heavy weight being pushed down on the whole face and neck to keep everything straight. And as you do it, you can feel the muscles in the back of the neck and shoulders tightening up. At the same time, she is pushing down her arms with the elbows flexed at 90 degrees, and this is now tightening up the muscles at the back of the shoulders and upper arms. What we are wanting to do is improve mobility in the neck, and we're looking at people either with poor mobility or with neck pain. The most important point to stress is that anybody with pain or numbness or tingling going down the arms should not be doing this exercise. Here we see this lady slowly flexing the head, bringing the left ear towards the left shoulder. When it begins to become tight, she pushes a little bit further and then slowly counts to 3. 1 and 2 and 3, returns to the midline, and then goes over the other direction, keeping the shoulders square and bringing now the right ear towards the right shoulder. When it gets to the extreme, tiny bit further, and slowly counts to 3. 1 and 2 and 3, and relaxes completely and repeats the process on the left and then the right, going in each direction some 10 times, each time for 3 seconds, repeating the whole process 3 times during the day in total. Again, we stress that any given exercise that causes more pain, that lasts for an hour or more, overdone, and one should get input from a physiotherapist or doctor or rheumatologist. Remember that some discomfort may be expected as you begin to stretch and strengthen your muscles. Don't be unreasonable with yourself. Don't push too hard. Stretch only to the point of mild discomfort, not pain.
Get used to maintaining a good breathing pattern throughout your exercises. If you find that you're holding your breath at any time, relax. Breathe in and out normally.
We next move on, still dealing with the neck, to rotational exercises. Here we're trying to help the neck swivel round further. A very important program for anybody who wants to continue driving without neck discomfort or poor vision because of poor rotation. Here we see the chin slightly flexed, twisting over to look over the left shoulder. And now going in the other direction towards the right shoulder, waiting until the extreme is reached, then a little bit further and counting slowly for 3 seconds. 2 and 3 and back to the midline and the neutral position. In each direction 10 times, each time for 3 seconds, repeating the whole process thrice daily. As with any exercise, position is important. And we see her here sitting on a firm, comfortable dining room type of chair that's supporting her back, and she can hold on to the seat, making sure that the shoulders do not move. We don't want there to be any cheating. We want just the musculature around the neck to be exercised in this situation. Again, to stress, if she develops numbness or tingling or pain going down the arms, she should stop that exercise. If she develops any dizziness or giddiness or buzzing in the ears, she should stop the exercise and get advice. We now come to shoulder mobilizing exercises, particularly useful for those with a stiff shoulder, sometimes called a frozen shoulder. The idea is that the good arm supports the body and the painful arm falls forward with rotation, letting it just fall backwards and forwards as if blown by the wind. After doing it in this direction for a bit, we then go crossways, going to the right and left, making sure one doesn't overdo it at the extremes, stopping just before it becomes painful, but each time trying to increase the swing a few degrees at a time. And then we go in a slow circle. Now this exercise can be done in one direction and then the other, first without weights and then with the addition of a weight. And the best is a potato or a can or a tin. That often makes the exercise a little bit more comfortable because the painful shoulder joint is distracted or pulled apart a little bit, and this allows some increased movement. It's important not to overdo it. If it's painful while doing it, then perhaps you're doing too much and you should ease back. We're still with shoulder exercises improving the mobility. One of the simple ways is to face the wall and slowly elevate the arms, the good arm helping the less good one. And a good way of making mobility easier is by using a slippery sheet or towel that slips up the wall, and as we see here, one reaches the position where there's limitation of movement and then tries to push it a little bit further, reaching that side, slowly counting 3, then relaxing, lowering the arms, only to repeat the procedure, each time trying to increase the movement by an extra millimeter or so. This should be repeated some 10 times, again 3 times a day. Now, continuing the exercise, rather than facing the wall, we see that the patient is sideways onto the wall and is working with the bad, painful shoulder, elevating the hand as high above the head as possible. When it begins to be tight, going an extra millimeter or so, counting 3 slowly and bringing it down. Repeating that procedure 10 times, 3 times a day. The position that one stands in is a question of common sense. At first, when the shoulder is painful with limited mobility, you may be quite far from the wall. But as the amount of movement increases, the position will become slowly closer to the wall until the mobility of the shoulder returns to normal. Here we see a very simple but important exercise whereby one arm is supporting the other by way of the walking stick. The painful arm, the weaker arm, is being helped by the arm on the other side. And as you can see in this exercise, we're increasing the flexion of the arm. She is waiting just to where it begins to get tight, and then she does an extra couple of degrees. Now slowly returning to the neutral position, and once more she's lifting the stick, supporting one arm with the other, and now it's just beginning to pull. She's going a tiny bit further and slowly counting 1 and 2 and 3, and now relaxing back to the neutral position. As the pain decreases and as she becomes more confident, she will wait for a slow count of 5 seconds or even longer. Now you can see she's stretching the elbows, because we always want to maintain total mobility of the elbow joints, and by lifting the stick in this position, the arms, which may be in a slightly flexed position, are fully extended. There will be some pain towards the extreme, and she will just stop when she gets the pain, tries to go a little bit further, and then holds it slowly for 5 slow seconds. Repeating that same exercise 10 times and thrice daily. As improvement occurs, she can begin to add simple weights. Here we see a 2-pound weight tied to the stick. Any simple home device can be used to increase the weight of the walking stick or umbrella that's being used for the exercise program. And the weight can be slowly increased as the mobility and as the muscle strength improves. It's always important not to rush into these exercises, to go gradually, increasing over a few days or even 2 or 3 weeks, from no weights to additional weights. If doing the exercise 10 times results in pain that lasts more than 30 minutes or more, then ease back and do the exercise just for 3 slow seconds, 4 or 5 times, then building up again slowly. Let's move on to some exercises for the muscles of the lower back. This lady, for example, is going to be carrying out a home exercise program to strengthen the low back muscles and, of course, the abdominal muscles at the same time. These exercises she will carry out 3 times a day at home. Duration is only about 5 minutes or so. First, she gets herself into a comfortable position, lying on a firm mattress or on the floor, whichever she prefers, slightly flexing her legs, tightening up the abdominal muscles, pushing down in the low back, tightening the buttock muscles, and then counting 5 seconds slowly. 1 and 2 and 3 and 4 and 5 and she relaxes. And we are asking her to suck in her abdominal muscles, to tighten them up, and to press down while she does this, so that there's no gap, there's no space between the small of her back and the surface that she's lying on. And this sequence, after a few seconds rest, is then repeated 10 times, each time for 5 slow seconds. The exercise itself may cause some increasing pain for anywhere from minutes to half an hour or more. One must be sensible, and if you find that it really makes matters worse, then of course discuss it with a physiotherapist or with your doctor or rheumatologist. We now come to the hand exercises. Flexing laterally and medially at the wrist maintains good wrist function. Then we focus on the small joints of the hands, making a circle using the thumb and index finger, and then the thumb and third finger, fourth finger, and fifth finger. This allows full movement of the small joints and the tiny muscles in the palm and outer side of the hand. One needs also to grip fully, full flexion of the fingers, maintaining full flexion on the one hand and extension on the other. There is probably no more important group of exercises than those for the knee. Remembering that we're not exercising the knee itself, but the muscles above the knee that do most of the hard work for the leg. There are several different points that need to be stressed. First, when the knee becomes painful or swollen, it tends to flex up. In other words, it's impossible for the patient to straighten out the knee completely. And here we see the leg being straightened with a very simple maneuver. The patient's foot rests on a little cloth cushion on a smooth tray. And by so doing, the leg can be pushed out and the gap between the back of the knee and the support disappears as the knee is straightened out, tightening the muscle in the front of the leg above the knee. So this exercise not only improves the mobility of the knee, allows full straightening of the knee, but strengthens and stretches all the muscle groups above the knee and indeed below the knee. The first 2 or 3 times when the initial straightening out of the knee and stretching is done may be a bit painful, but within a few moments the knee then will become a bit looser and the remaining program will be easier. Of course, if the pain persists for a long time, then you need to ease off and get advice. Once more, we ask the patient to bend the toes towards the head, push down with the muscles above the knee, and get rid of the space between the back of the knee and the support, and hold it for 3 slow seconds. This is the first exercise to do, because once the knee becomes straighter, then all the muscles around the knee will work better and therefore more ably be stretched and strengthened. So having then done that, we now move on to improve the strength of what we call the quadriceps muscles above the knee.
Early on, the knee might be quite painful, and a very gentle exercise is supporting the knee with a wrapped up towel or blanket. We must stress that one should never sleep at night or rest during the day with a blanket under the knees. The only time a support under the knee is allowed is for this specific exercise. As you see, the patient is stretching the leg by simply lifting the foot, and so the thigh and lower leg becomes horizontal. The leg is held up in that position for 3 slow seconds and then allowed to drop back. And that is carried out 10 times. At first without weights. And when and if that becomes simple, then weights are attached. And then with the addition of the weights, the foot is extended and the leg straightened for at first 3 slow seconds and then building it up to 5 or even 10 seconds for 10 times, 3 times a day. When each series of exercises becomes simple, one increases the weights and carries out exactly the same. At first with only 1 pound, and then 2 pounds or a kilo, building up to 2, 3, or even in an otherwise healthy individual, up to 4 kilos or 8 pounds. And to finish up, there are some exercises that you can do for your feet. So first of all, sitting in a comfortable chair on the side of the bed, without shoes and socks, you begin slowly to rotate the foot from the ankle. And as you slowly rotate, bringing the foot, the toes right up to your head, and then on right down towards the ground, you will feel the muscle stretching in the back of the lower leg and in the front. After you have rotated, say 5 times slowly in one direction, now begin slowly going in the other direction. And after 5 slow turns like that, you take your foot and you push down as far as you could go, squeezing the toes as if you're making a fist with the foot. And then you relax completely, turn the foot right up and spread out your toes like a fan. And you repeat that 10 times slowly, counting to 3 seconds on the extremes of movement. Remember, you need to proceed at your own pace. Your body will tell you what it is capable of. Try to build up your level of exercises gradually. Begin with only a few repetitions and build to more as you find your body better able to cope. And for those who have access to a pool, swimming is excellent for strengthening many muscle groups, especially those of the lower back area, as well as for maintaining general fitness. One of the problems of exercising with arthritis is that gravity constantly puts some stress on the joints of the lower body. Not so in water. The uplifting effect of buoyancy counteracts gravity, so movements that are difficult out of the water may be quite feasible or even enjoyable in the water. Water resistance protects the joints and provides means of strengthening the muscles. Water exercise is possible at home. You can do leg, foot, hand, and finger movements in the bath. The joint being exercised needs to be underwater so that it enjoys the benefits of buoyancy and warmth.
The time following an exercise period is an ideal time to practice relaxation. Regular physical exercise helps to release general muscle tension, and relaxation serves as a natural complement to physical activity. Pain management specialists tell us of the interaction between stress and one's perception of pain from your arthritis. With stress, you seem to experience more pain. You get depressed, which creates only more stress, and so on in a vicious cycle. Learning how to relax, therefore, should help you cope better. There are a number of ways to achieve the kind of relaxation that can help relieve your tension. You may want to consult your doctor or physiotherapist or support group in your area for more information.
We've shown you some techniques which should help you feel better. You have the tools to help yourself. You have the ability to play a vital role in helping to improve the quality of your life, to move from watching life pass you by to getting back into the mainstream. Before we go, let's remind you about some things we've talked about.
Remember, treat your exercise as something you have to do. Make a commitment. Start slowly and build up gradually. Listen to your body. It will tell you what its limits are. Look for ways to make the exercises enjoyable. You may try exercising to some gentle music. Don't do an exercise to the point of pain. A little discomfort is as far as you should push yourself. And if pain persists for more than 60 minutes after you've completed your exercises, you've done too much. Reduce the amount next time you try. Stop exercising immediately if you get chest pain, become severely short of breath, feel dizzy or nauseated. And make sure that before you begin any exercise program, you consult with your physician or therapist and get in touch with them if you're experiencing any difficulty.
As a rheumatologist, I have come to appreciate how important it is for you, the patient, to share in the responsibility for your own care. Exercise is one very good, very important way to be proactive on your own behalf, to do what you can do to help yourself feel better. So begin soon and make exercise a habit. It can be part of a thoroughly modern approach to treating your arthritis.